I promise I'm back. Good evening once again. Welcome to today's video where we are taking a look on the study of what we call the characteristic features that differentiate between artery veins and what we call the blood capillaries. If you find this video helpful at the end of it, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now in the previous videos, we have been looking on what we call the characteristic features that defines arteries and what we call the veins. We also looked on what we call the different types of what we call the blood capillaries, where we said we have what we call fenestrated, the sinusoidal capillaries, and what we call continuous capillaries. We said we have three types of what we call the capillaries. In this video, we want to take a look and see those kind of the characteristic features that are going to be differing arteries, veins from what we call the capillaries. Let's go ahead and get started. So now this structure here is going to be showing all those kind of the tunic layers of what we call arteries and what we call the veins, because the tunic layers of the arteries and the veins are going to be exactly the same. But when you come on what you call the tunic layers of what you call the blood capillaries, they are so much different. Let's go ahead and see those kind of the characteristic features which differentiate this kind of what you call the blood capillaries from this kind of what you call the arteries and what you call the veins. Okay. So now this one here is going to be our artery. Is going to be our artery stroke vein, because those kind of the tunic layers are going to be exactly the same as of what we call the veins. Okay. And then this side here is going to be our capillary. Okay, this side is going to be our capillary. Now, when you look on this kind of the cross section of what you call the artery and then what you call the vein, because they're going to be sharing the same kind of the tunic layers, we want to go ahead and see these kind of the critical kind of the layers that defines an artery and what you call the vein. When you come over inside here, we are going to be having an endothelial lining, which are going to be making the inner lining. Okay, so now these kind of the beautiful cells here are what we call the endothelial cells, and they're going to be making what we call the endothelial lining. Okay, they're going to be making what we call endothelial, endothelial lining. Okay, and these kind of these beautiful endothelial cells, they are going to be seated on this beautiful kind of this membrane. You see this kind of this membrane here, this blue-like membrane here. This one is so much special. It provides the sitting point of this what called the endothelial cells, and this kind of the membrane is what we call the basal lamina. Okay, is what we call the basal lamina. In some other textbooks, they call the basal lamina as what we call the basement membrane. Okay. Then as you come out from what you call the basal lamina, we have another beautiful layer of the connective tissue. This one is super very important. You see this beautiful layer here, this one which is a bit red. That one is what we call the subendothelial layer. Okay, is what we call the subendothelial layer. Okay. And then when you come out from what you call the subendothelial layer, we have this green like of this kind of this layer. This layer is made up of what you call the elastic kind of the tissues. Okay, and this kind of this beautiful layer is what we call the internal elastic lamina. Okay, so now this beautiful layer here is what we call the internal elastic lamina. Okay. So now these beautiful layers, the endothelial lining, the basal lamina, the subendothelial layer, the internal elastic lamina, these layers combined together, they make the inner layer of what we call the arteries and the vein, which we call the tunica interna. Okay, so now all these layers here, they are going to be making up what we call the tunic interna. Okay, they are going to be making us what we call the tunic interna, meaning that the tunic interna is going to be made up of what we call the endothelial lining layer, the basal lamina, the subendothelial layer, and the internal elastic lamina. Okay, it is such Another beautiful. So now after you come out from what you call the internal elastic lamina, we have this beautiful kind of the layer. It is one of the most thickest kind of the layer for the case of what you call the arteries than what you call the vein. And this kind of this layer is going to be made up of what you call smooth muscles. Okay. So now this beautiful layer is going to be what you call a smooth muscle layer. Okay. It's going to be what you call a smooth. Is going to be what you call a smooth muscle is what we call a smooth muscle layer. Okay. So now as you come out from what you call this kind of the smooth muscle layer, we have another beautiful kind of this layer here. Okay. You see this beautiful layer, it's going to be labeled like black here. This beautiful layer is what we call the external elastic lamina. Okay. So now this beautiful layer here is what we call the external elastic lamina. Super very important. And the external and then the internal elastic lamina, they are going to be providing that kind of the stretch and then the recoiling ability of this kind of the arteries and what you call the veins. We are going to be having so much well developed kind of the internal and the external elastic lamina in what we call in arteries. And of course, for the case of the veins, not going to be all that well much developed, and even some kind of the veins are not going to be having what we call the external and the internal elastic lamina. Okay, but in arteries we have developed external and then internal elastic lamina. Okay, so now this external elastic lamina and then the smooth muscle layer together, they make another middle kind of what we call the tunic. And that kind of the middle layer of this kind of the arteries and the veins is what we call the tunica media. Okay, is what we call the tunica, what we call the tunica media. So now when you talk about the tunica media, it's going to be made up of this smooth muscle layer and what we call the external elastic lamina. It is such another beautiful thing. Okay. And then the last one outside, when you move outside, you see this kind of green layer, the last one outside, which is going to be made up of what we call the dense, fibrous, irregular connective tissue, which is super very important, providing what we call the protection and different structures. This beautiful layer, it is the outermost layer, is what we call the tunica externa. Okay, this beautiful layer here is what we call the tunica externa. Okay, is what we call the tunica externa, but in some other books they call it the tunica adventitia. Okay, so now it's also called the tunica externa, or what we call the tunica adventitia. What is very much beautiful with this kind of this outermost layer is that it's going to be having kind of what we call tiny kind of the blood vessels that are going to be supplying them with what you call the oxygen and even also what we call other kind of the nutrients. These kind of the arteries, they are going to be supplying blood to the all of what you call the tunica externa, and even they can even move ahead and also supply the outer parts of what we call the smooth muscle, which are calling the tunica media. Besides that, they're also going to be having some little bit of what you call the nerves, this kind of the tunica externa. You see this kind of these nerves. These nerves are super very important. They are going to be part of what we call the tunica externa. Okay, so now those are the kind of what you call the tunic layers, of what you call the arteries and what you call the veins. They are starting from inside, which is going to be having the tunica interna, which is going to be made up of what you call the endothelial lining, basal lamina, subendothelial layer, and then the internal elastic lamina. And then when you come to the middle layer, which you're calling the tunica media, is made up of what you call the smooth muscle layer and what you call the external elastic lamina. And then the last one outside, which is what you call the tunica external, what you call the tunica adventitia. Okay. Now, when you come over on what we call the capillary is so much funny. Okay, and the fact that it's going to be now one of the most tiny kind of what we call the blood vessels, that's why they're going to be having very few kind of a layer. See this kind of blood capillary. When you see it critically, it is going to be having endothelial cells. Okay, it's going to be having what we call the endothelial cells. And then when you look it outside, next what we call the endothelial cells. These endothelial cells are going to be seated on this beautiful kind of the membrane, which you call the basal lamina, what you call the basement membrane. And of course, this kind of the basement membrane is going to be providing that seating surface of this kind of what we call the endothelial cells. Okay, so now this kind of the capillary is going to be having this kind of the endothelial cells. See this kind of these cells here. these cells here are what we call the endothelial cells. And then, of course, slightly outside this kind of the endothelial cells, we have this kind of this beautiful layer we're calling the basement membrane, or even some people call what we call the basal lamina. In some other beautiful kind of the capillaries, like for example the continuous capillaries, we are going to be having this beautiful kind of the cells. You see this kind of this green like cells. This green like cells, which we call the pericytes. Okay, in some of the capillaries, which we call the continuous capillaries, provide what we call the growth of the endothelial cells. Okay. And even also when you see this basal lamina, in some other kind of the capillaries, they are going to be discontinuous. Okay, they're not going to be complete, they're going to be having some little kind of what we call holes. Okay, and this one is going to be classic of what we call the sinusoidal type of what we call the capillary, which can also be called what we call the discontinuous type of what we call the capillaries. So now when you compare this kind of the blood vessels, you realize that the arteries and what we call the vein, they're going to be having multiple of the layers, and of which these kind of the capillaries are going to be also having what we call the endothelial lining and what we call the basal lamina. Meaning that when you see these kind of the capillaries, they are going to be stopping when you compare it with the arteries and what we call the veins. They are going to be moving from here. They are going to be moving from here up to here. Okay, so now they're only going to be having these kind of the layers, the endothelial cell lining and what we call the basal lamina. And this one is so much important because these kind of the blood vessels are going to be allowing exchange of different kind of the substances. That's why they have to be very much thin to allow the easy diffusion of different kind of the substances in and out of what we call the blood capillaries. Okay. In this video, we have covered a brief comparison between what we call the capillaries and what we call arteries and what we call the veins. If you think whatever I've talked in this video is really making sense, is adding to you, you are benefiting, please you can support TUMNAD lectures. And that one can be done with a couple of means. You hit the like button, comment down in the comment section, and please subscribe. So now in the next video, we are taking now into a new kind of the concept, which is going to be dealing with what we call the study of the blood, which is a fluid connective tissue and also a component of what we call the cardiovascular system. Thank you very much for watching. As always, TUMNAD. Until we meet next time.